Hi, my name is Sophia Rudolph, and I did a research paper on osteoarthritis in horses. So, why should you care? Horses were and are many people's main mode of transportation for much of human history. They have been used for jumping, polo ponies, dressage, and work, usually performed continuously. These activities require substantial training and depend on maintaining joint safety and comfort. Many suffer from joint cartilage damage. Dysfunction can decrease the joint's load bearing strength and ability to move freely. So this is some background information. Joints contain connective tissue such as cartilage and collagen. Cartilage absorbs the shock and collagen tissue gives the joint strength and structure. Cartilage structure is the extracellular matrix, also known as ECM. Cells produce fiber and collagen, which form the ECM reinforcing cartilage tissue structure. And hyaluronic acid, HA, lubricates the joint and helps the cartilage absorb shock. And osteoarthritis is it arises from the overuse and wear and tear on the joints. OA is quite common in horses, and among horses over 30 years, the prevalence of OA increased to 80 to 90%. OA joints experience decreased production of HA. The cartilage structure begins to break down during normal use, and health of the cartilage in a horse is central to the health of a horse's joint diagnostics and treatment of osteoarthritis stems from the cartilage. So, these are 4 different diagnostic tools for osteoarthritis. So radiographic tools are generally the most employed imaging tool to assess bone changes in joints, such as new irregular bone formation, development defects, reduction of joint space, and others, and it creates an image of bones and dense structures. An ultrasonographic examination can be used to early identify if a horse has osteochondral irregularities, and it uses sound waves to create images of soft tissue. We also have thermal imaging cameras. They detect changes in the surface of the blood flow on the hock and changes in the blood flow within the hock. Video recordings are analyzed using software to measure the biomechanical movement of the hock and fetlock. And last is gait analysis or lameness check. Basically, someone is on the ground and gives you a clear perspective on how your horse is feeling based off the horse being ridden or on a lead line. And the lameness is a limb or body that hurts enough that the horse alters its gait to control the load the affected limb has to bear. And the gait is just like how the horse moves, and if you see that they move any differently. So now we'll be talking about the different treatments that can be provided. So first is physical therapy. You should warm up the horse, first walking around for 10 minutes and then trotting for 7 minutes both ways and cantering both directions. Then you can go into your jump activity, ending it with a good cool down of walking around until the horse stops breathing so heavily. Notice the change in behavior and level of comfort before you start riding, and keep your horse in regular, consistent work, maintaining comfort and soundness. Pulls or low cavalettes also can encourage the horse to pick up their legs, and horses will use more of their upper limb muscular fore and hind, and also in the process use their top line and core strength to do so. So this is like a good exercise that your horse can do. And personally, I take like 20 minutes to warm up my horse, and then for another couple minutes, then walk again for around until I begin jumping and doing my course, and take break in between each of my jumping courses. Next is shockwave therapy. For bone and ligamentous injuries, pressure waves generated outside the body can be focused at a specific site within the body. Pressure waves travel through fluid and soft tissue, and their effects occur at sites where there is change in impedance, such as the bone-soft tissue interface. Electromagnetic mechanism has coils that create opposite magnetic fields when an electric current is applied to them, causing a submerged membrane to move, starting a pressure wave within the fluid. Electrohydraulic method uses a high voltage spark gap, and the spark generates a plasma bubble that compresses the liquid, initiating the pressure wave, and it can be utilized in the horse without acutely damaging the surrounding soft tissue. Next is oral supplements. So besides having supplements and medicine, first is a good base of just a good nutrition or diet. If horse has excessive inflammation, you can get supplements that cause cartilage breakdowns using degradative enzymes. Healthy amounts of inflammation are supported by omega-3 fatty acids, glucosamine, acetylmistrolate, antioxidant, vitamin C and E. Glucosamine can help build certain cartilage parts. Silicone can straighten the bone and soft tissue around it. Alone are not necessarily effective, so you still have to have like mentioned before, a good nutrition. And this is an example for what I use for my horse is glucosamine, and I just give it with their grain or their food. Next are hyaluronic acid injections. This is when the joint is inflamed and painful. Injections are the best way to go. Horse does a lot of jumping and general work. It would be best to give them injections because it relieves pain and reduces inflammation in the hock, making it more comfortable and impacting their overall performance. If one is getting injections for their horses because they are sore, they are most likely going to have to continue getting injections because they are going to start to have what is considered low-grade arthritis. And because some of those drugs can cause a mild inflammatory reaction in the joint, you always want to give them enough time to let that go away. So within hyaluronic acid injections, there is hyaluronic acid, and this is a chemical structure of it. Exogenous HA can enhance chondrocyte HA synthesis, prevent the degradation of cartilage, and promote its regeneration. If you inject more HA, it helps chondrocyte produce HA only if the cell is found in a healthy cartilage. And it reduces the production of pro-inflammatory mediators and matrix metalloproteinases involved in OA pathogenesis. Osteoarthritic joints synovial fluid contains a lower concentration of HA than in its healthy joints, so intra-articular therapy with exogenous HA can restore its viscoelastic, so it makes it more stretchy and like bouncy, I guess. It reduces the production of pro-inflammatory mediators and the matrix metalloproteinases and reduce nerve impulses and nerve sensitivity associated with OA pain. And HA goes through the cell receptors. It decreases the number of matrix metalloproteinases. The tissue in the joint has more structure to it, and it also decreases the number of inflammatory mediators. So, take home message: every single horse is different, and the vet will tell you which treatment and diagnostic is best for your horse. Most procedures have long treatment times and work slowly, so patience is required. Oral supplements and injections have similar active ingredients, HA, MSM, etc., that work to rebuild joint function. Thank you.